Assalamu alaikum. Today we'll have a recent study done by a group from Michigan at University of Detroit Mercy. The study titled with long-term outcome of pre-doctoral root canal therapy, retreatment and tooth loss in a 17-year institution cohort published in JOE last April 2026. This paper looked into the long-term outcome of durability of root canal treatment and the failure pattern of this retreatment that performed by pre-doctoral dental student. Since the non-surgical root canal treatment is generally considered as a highly predictable procedures. However, some cases might develop of post-treatment disease necessitating for retreatment or in some severe cases of tooth extraction. The success of these treatment rely more on the effective of canal disinfections and maintenance of the durable coronal seal. While endodontic standards are strictly taught in the academic institution, there is a lack of structural investigation that link the overall institution durability of root canal treatment to a detailed characterization of biological and technical and restorative factors. Where many studies focus on the retreatment as a failure metric, which fail to capture the full spectrum of the outcome, specifically with a definitive endpoint like tooth loss. Therefore, um, this study was aimed to evaluate the durability of pre-doctoral root canal therapy through a three-phase retrospective evaluation. In the phase 1, they want to quantify the frequency of non-surgical retreatment of all undergrad root canal therapy. In the phase 2, they want to have a detailed review of the retreatment teeth and what are the etiological assessment of the radiographical quality and the preoperative diagnosis and the timing of the intracoronal core placement. And in the phase 3, they want to link the undergraduate root canal therapy record to a subsequent extraction coded to evaluate the downstream tooth loss and the time to event pattern. It is a retrospective cohort study that conducted at academic dental institution at Detroit University, covering cases from 2008 up to 2025, including a total of 7,340 non-surgical root canal treatment that performed in the pre-doctoral clinic. This study revealed that the need of non-surgical root canal retreatment in a dental institutions are relatively low, with only 1.78%, while extraction is relatively high with 7%, combining the adverse outcome or the failure rate to a total of 9%. Molar had the highest retreatment rate with 2.7% compared to the premolars and anterior teeth, with the median time of retreatment was about 1.5 years. While extraction that occur much later than the retreatment at the median time of almost 2 years. Consolidating the etiological assessment along with the radiographic evaluation identify that the suspected coronal leakage or loss of the coronal seal based on the radiographical evidence as the most common primary indication for retreatment, followed by the obturation related deficiencies like short obturation, missed anatomies, voids, and overextended and etc. Teeth that are documented with intracoronal core were retreated significantly sooner to a median of almost 6 months than those that placed with core with a median time of almost 1.5 years. And the preoperative bulbal diagnosis among the retreated teeth were predominantly with symptomatic irreversible pulpitis and normal apical tissue. And the survival analysis showed no statistical significant difference between the tooth type, either anterior or premolar or molar. As a conclusion of this study, within the limitation of this study as a retrospective design that conducted at single center and not including all cases that retreated or extracted outside of this institution, the primary root canal treatment in pre-doctoral undergraduate student is highly successful, with the retreatment is relatively low with 1%, and the extraction that occur later. This finding of this study highlight that the early root canal treatment failure is primarily due to the biological aspect of the coronal leakage, emphasizing on the importance of the preventing of recontamination of root canal system, and extraction which occur later, resulting from more of compromisation of the tooth structure and restorative factors of like placing a core or not placing a core. Thank you.